There's a push for schools to reopen and offer in-person learning. New this week, Governor Cooper and state education leaders are joining that call. Joshua Senegal has more on why they say now is the time to allow in-person learning.
This week, Governor Roy Cooper is strongly urging public schools to allow students back in the classroom.
Educators, parents, and students have persevered. We've learned much more about this virus. And now it's time to get our children back into the classroom.
Some school districts have already returned to in-person classes, but many still rely on remote learning. And state leaders say those children have a higher risk of suffering from learning loss, mental health challenges, and food insecurity.
We also know that remote learning and this pandemic have taken a tremendous toll on thousands and thousands of families, disrupting jobs, childcare, healthcare, social networks, and even food security. In short, this crisis has negatively impacted students' mental health and overall well-being, as well as their academic preparation.
North Carolina Secretary of Health and Human Services, Dr. Mandy Cohen, says the data shows schools have a low rate of COVID-19 transmission as long as there are prevention measures in place. She also points to research showing that kids infected with COVID-19 generally have mild symptoms or none at all, and they're less likely to spread the disease.
A study by North Carolina's ABC Collaborative found that if someone is attending school had COVID-19, it was very unlikely that they got COVID-19 at school or that they gave it to anyone else at the school.
Dr. Cohen notes that teachers are considered essential workers and are up next to receive the COVID-19 vaccine. Joshua Senegal reporting for COVID Uncovered.
I'm joined now by Dr. Danny Benjamin, a distinguished professor at the Duke University School of Medicine. I'm told everyone calls you Danny. So Danny, thanks for joining us today.
Great, yeah, all the 7-year-olds in clinic do that, so David, you should do the same. Thank you for having me.
Sounds good. Danny, you were involved in that study that Dr. Cohen just mentioned. What were some of the main takeaways?
So fundamentally, what schools need to do is to prevent transmission of COVID-19 at school. We know that children will come in infected with COVID-19. We know adults will be infected with COVID-19, and they'll come to school with it. But what schools really need to do is to prevent them from infecting each other once they step onto school property. If we can do that, then we provide a safe work environment. And if we have a safe work environment, we'll have a safe learning environment. And it's clear from our study and others that schools are a safer work environment than the general community.
So why do you suspect that there were so few COVID-19 transmissions within the schools that you studied?
Fundamentally, what you have is a group of adults who've committed their lives and their professional goals to provide a safe work and learning environment. Principals, teachers, school bus drivers, cafeteria workers. You know, when was the last time you had to say to yourself, gee, I wish that school bus driver would not text and drive? You don't ever see that, right? You don't ever see school bus drivers getting liquored up and driving down the road. These are people who are dedicated to safety. And they took simple instructions and they applied it to COVID-19 and they applied it to the work environment and they provided a safe environment for children and for adults, as they always do.
So how confident are you that if school districts follow these safety protocols that you mentioned, that they'll be able to limit cases within the schools?
I'm confident of three things. Number one, if schools are closed and only do remote learning, we will have cases of COVID-19 and we'll have tragedy. If schools are open, we'll have cases of COVID-19 and we'll have tragedy. But what I'm very confident of is that schools will have limited within school transmission if they do the mitigation strategies. And that data is backed up by not only our study, but also Wisconsin and Mississippi and 10 other studies in the peer review literature. You gotta have the mitigation strategies, and if you do, you can provide a safe environment.
Now, some are arguing with this debate of reopening or not that we should stay with online classes until teachers and school staff can be vaccinated. What do you think is the value of providing a vaccination to these school staff and to the teachers?
Well, fundamentally, whenever you vaccinate one group of the population, you deprioritize another. So if I prioritize school staff, then some other essential workers get deprioritized. When I vaccinate somebody who, say, works in a grocery store, I've done a great thing for that person. I've helped them and their family. When I vaccinate a school bus driver or a teacher, I've helped them and their family. But the value proposition of prioritizing school staff is I help not only that bus driver, but I help the 30 people who ride the bus with that bus driver and the 30 people the families of those 30 children. And when I prioritize school staff, I have not only those school staff, but I touch all of those children and all of those families. And so while only 20% of the population is children, 50% of the population is directly impacted by the school system, whether it's as a child, a sibling, a family member, a caregiver, or an employee. So the value proposition to public health is to vaccinate school staff now.
And hopefully it will be soon. Danny, thanks for taking the time, and thanks for lending your insight on this topic.
Great, thank you.